Hello friends, today I am going to put before you an important discussion about an distinguished homeopathic medicine in our materia medica, Iodium. You know, my friends, that iodium is an element which belongs to halogen group. The cardinal feature or the main characteristic of iodium is its power of absorption. Depending on this feature or power of iodium, the physicians of old school extensively painted this medicine in those portion of the patients where there was edema or swelling. But when administered internally, its power is enhanced, and as a result, the absorption takes place in muscle tissues and also in fats. Due to this extensive absorption, ultimately the patient suffers from general emaciation. Patient also have ravenous appetite. Therefore, ravenous appetite as well as marasmus or emaciation is a cardinal feature of iodine. It may be assumed that the ravenous hunger is stimulated due to the loss of mass due to excessive absorption of iodine. Iodine patient also has anorexia or loss of appetite. Therefore, ravenous appetite and anorexia or complete loss of appetite goes side by side in iodium patients. Dr. Clark has mentioned in his Materia Medica that he had met two ladies patients who were suffering from nervous shock and were suffering from anorexia with this nervous shock. He administered iodine in low attenuation and it healed a good and brilliant result. But he has mentioned that in both cases, the patients had dark complexion, that is, dark eyes and hair. It is also a good indication or indicating feature of iodine. Iodine acts best in those patients who have dark complexion. Iodine patient is thought as uric acid. So, every suffering of this medicine is aggravated in one environment and the patient searches for cold surrounding. Iodine patient is to some extent scapula. Patient is very much susceptible to cold, and the glands of submaxillary and cervical region becomes swollen and indurated. But one thing to be remembered in this connection that the mammary gland of iodine patients dwindle, withers, and dried up. Iodine has a special affinity for all glands in human body. Goiter is a disease where iodine may be indicated if symptoms correspond. Dr. Nash has depicted in his Materia Medica that he has used many cases of goiter using iodine CL for one dose for 4 consecutive days after the full moon when the moon wanes. Iodine also have a leukorrhea symptom. The leukorrhea is too much corrosive and it may cause hole in the linen. It is so much corrosive. Iodine patient also suffers from priapism. That is, its sense, every sense is enhanced. And the patient is restless, wants to kill somebody, and also very irritated. Iodian, Iodian patients are very much anxious also. Iodium may be indicated in case of pneumonia, dry cough, and consolidation of lungs also. This is all about iodium nitrate. As I hope, please subscribe my channel if you are benefited from my lecture. Thank you. Have a good day.